But here are the beautiful faces of all of our rising third years that you all are so excited to meet. And we're excited to get them back into your clinical spaces to learn from you. So just to kind of highlight the agenda for this evening, the main objectives is to kind of go through some of the changes that have been occurring. I know in all of our clinical spaces, everything has been transitioning. And once you policy or a procedure, it changes. So our students are well versed in being flexible and adaptable. They were transitioned from the clinical spaces one day and on virtual didactics the very next day. And then they transitioned to full-blown online curriculum for the next 8 weeks. So they are very well versed and amenable to changing along with us. So let me first start by saying thank you so much for the role that you play in teaching and mentoring our medical students. I hope that this evening helps answer some of your questions, and thank you to those who completed the pre-survey. So we took your questions to put together the presentation. If we don't go over your question or it's still unclear, we will get to a question and answer, which we hope will be the majority of time of this evening. If you're like me, I forget questions as we go through. So I just wanted to kind of highlight some housekeeping items. We are recording this session as there are several people who had a competing meeting this evening who were very interested in what is being said. So just letting you know that we are recording this and that this recording will be available for distribution if you want to go back through any of the details. Also, if questions arise, I tend to forget them. Feel free to go ahead and put them in the chat box so that we can make sure that we address them at the end. The other request is that if you will please remain muted until the end, it just feedback that occurs on all of these virtual meetings. So as you will see from the agenda, we're going to have some comments from Dr. Hall and Dr. Steiner. We'll go over some of the curricular changes due to COVID. We'll review very high level detail about what the students have been doing and how we are preparing them for your clinical spaces. My most exciting part of the evening is being shared between 2 of our students and 2 of our faculty who actually have had experience for the past 4 weeks doing virtual visits in the clinical space. Then we'll just briefly touch on how you can maximize social distancing in your clinical spaces and then transition to the Q&A. So at this time, I would like to introduce both Dr. Mary Hall, who is the Chief Academic Officer and an Associate Dean for the Charlotte campus, as well as Dr. Steiner, who is the Senior Associate Dean at the UNC School of Medicine. So Dr. Hall, if you would like to say a few words, I will mute myself.
Thanks, Heather. And it is my great privilege to have this opportunity to welcome you tonight. You know, this has been a crazy year, a crazy few months, and an even crazier week with everything happening outside. And it's hard. I'm pretty good. I'm a natural optimist, good energy, but I'm having trouble sometimes finding my happy place these days, truly. I'll try not to cry right now, but given what we're all managing, our regular lives through a pandemic, and now what we're managing in our world for the past week or so, it makes me all the more grateful to have you join us today. And we always say that I think it is pure joy whenever I'm connected closer to purpose, whether with patients or teaching, residents and students, I'm happiest. And when we have students in our offices that can connect us to the joy of learning and to, you know, have a role, you guys, we couldn't have the School of Medicine here without you, to have the role of taking young adults and helping them to form into physicians and to teach them about your specialty and to teach them about who you are as a physician and what you bring to the field is just a great gift. And so I'm just very appreciative of each and every one of you and appreciative of you for spending time here tonight. So thank you. And now it is my joy to introduce a very long-time friend, a colleague and friend, Dr. Beat Steiner. When he became Senior Associate Dean, I said, hey, does this mean you're my boss? He's a family physician as well, so we go way back through the departments of family medicine and in our national roles together. So Dr. Steiner.
Thank you so much. And Dr. Hall, Dr. Tarantino, I think I'm going to say very similar things, which just a profound thanks to you. And I think this thanks is, like Dr. Hall said, even more important right now. So I've had a lot of conversations with students over the last several days. And in fact, we have a town hall tomorrow evening it will go from 4:30 to 6. And Dr. Tarantino can extend the invitation to all of you. We would love to have you join. We're going to focus it on these horrible events that have happened over the last week and well before that, unfortunately. And I say all that in combination with a thanks because our students are stressed. They're, I think, really anxious to join the clinical work again, but they're also pretty stressed for a couple of reasons. And I think the reasons are sort of explanatory. COVID added a level of stress about personal safety, about safety of their family, and of course, safety of patients. So I think the conversations you're having tonight are really important in helping you help reassure the students as they join. But then the stress of these political situations, many of our students are very personally, directly affected. And unfortunately, some students are affected more than others, which is causing further tensions. I think you can also be really helpful, even if beforehand, if you know some students, you can reach out beforehand. But certainly when they appear to you in your clinics, on your wards, be really mindful that the stress they're suffering are multifactorial. And I think you as gifted teachers will help them navigate that. So I'm profoundly appreciative of those efforts.
Thank you, Dr. Steiner. And at this time, I'd like to introduce Dr. Michelle Birch, who is our Director of Academic Services, who's going to touch base about some of the curricular changes that have transpired in reaction to COVID. Michelle?
Yes, thanks all. So as you can imagine, our students and we were all very disappointed that we had to interrupt this learning. But as we'll go through later, I assure you they are ready to hit the ground running. They will return to their curriculum June 29th. It is going to be a shortened year. As we said, it's going to be fast and furious. So they will have just 16 weeks in the outpatient curriculum. So it's a 36-week calendar. They'll only get 1 week off for Christmas. And again, everything's going to be compressed. So if they seem a little stressed, as Dr. Steiner said, there's a lot of things going on, but I assure you that they're doing a lot of neat stuff right now to get them ready and get ready to hit the ground running on June 29th.
Thanks, Dr. Birch. And so, one of the questions that came up in the pre-survey was around what are students allowed to do and what are their duties in this new era of COVID. And so just to kind of clarify and level set, students are allowed and encouraged to both see patients face-to-face as well as to be involved and incorporated into your virtual, whether that be video or telephone visits. And again, we'll have some of our students and our preceptors talk about their experience in those realms. One of the opportunities that COVID has just reinforced is that, you know, we've always really encouraged our students to interview and examine patients independently. That way they get practice of actually how to do things. And then if they miss key items, then you can provide feedback. With social distancing, that's going to be even more imperative to try to decrease the amount of time that multiple people are sharing small clinical spaces. Of note, The students' notes for virtual encounters can be used for billing if the attending or resident participates in that encounter or reperforms the encounter, just like you would in a face-to-face visit. The AAMC and CMS put out a statement, which I can forward on to you if your compliance officer or your office manager would like to have a copy of that. But just clarifying that if your practice allows you to use student notes for billing, that also includes both telephone and virtual encounters. Also, some of the questions that had arisen was about what type of infection prevention requirements the students could be asked to do in our clinics. Atrium Health as a whole is asking that all clinicians wear masks in every clinical space at all times. So that is a standard across all of our clinical spaces. We are also asked to wear eye protection in all clinical encounters. Our Office of UME has purchased protective safety goggles for the students to wear in the clinical spaces. So that is not something that your practice would have to provide. The students will come with that. And these are reusable, cleanable eyewear. Several of our practices are requiring symptom and temperature checks, and the students would be asked to follow any of those guidelines and screenings as any of the other staff in your practice. A couple of people reached out and stated that their practices are doing random screening of all providers and staff. If your practice is asking that, we ask that you let us know. And if you have any additional policies in your clinic, please let us know. For those of you who have communicated that with us, we've shared that with the students to make sure that they're comfortable with the nasopharyngeal swabs that are being done. And so far, all the students have no issue with that. We just want to make sure that they're informed before they get surprised in your clinical spaces. So please reach out to Celeste. She is the master of all with any questions, concerns, or policies that your practice may be asking of your staff and of the students. Another question that arose was around social distancing. Not all clinical spaces allow a true 6-foot window around all members within a clinical space. So just realizing that 6 feet is encouraged. If closer encounters are necessary for patient care as well as education, all we ask is that you try to limit the time in these closer instances, ensure that everyone is wearing the proper PPE. So for example, if you have a patient in an exam room with a student and there's not 6-foot space between where the patient would be sitting and the student would be sitting, that that the student is absolutely wearing masks, but that would be an opportunity to potentially ask the patient if they're comfortable in wearing a mask to also decrease risk. Also, just prefacing, because a couple questions arose about whether or not students are allowed to care for patients who are COVID positive. And the answer to that at this time is no. We are very open and acknowledge that these restrictions may change over time as the prevalence increases and as we learn more and more about the spread and reactions to COVID. Currently, if you have a patient who is being screened for COVID due to a system or clinic policy, but they're asymptomatic and low risk, then the students would be welcome to take part in that clinical encounter. Some of you have also asked if students would be able to take care of sick patients, and the answer to that is absolutely yes. That is key to their learning. So really the only changes that we foresee is trying to maximize social distancing while increasing the time or decreasing the time that the students would be potentially sharing space with the patient and yourself. And so at this time, I will transition to Dr. Birch again to go over what the students have been learning over the past 12 weeks.
Yeah, so some of you may or may not know, they actually did get started prior to getting pulled and managed to complete all of their required ED shifts. So that's great. Normally we spread those out over the year. And so that really has given them a leg up. They had really a 2-week boot camp in how to conduct the follow-up office visit, some things in terms of documentation, but as well as getting a good history, how they can help you out in the clinic. Our students have been really, these past 2 months, actively engaged in COVID from a number of different fronts. They have been having formal coursework through UNC, both on the virus itself, but some of the health disparities involved in them. We have been doing a lot of virtual didactics as well as training sessions, a lot of small group learning on this, as well as documented courses on looking at the social determinants of health with regards to this virus and the wider impact. They've been doing public health coursework. They have all been getting trained in telemedicine through that initial COVID course. And then some, as you'll hear from later, actually did a dedicated 4-week session on this. So I think you'll find that can be really helpful. And those students that didn't do a dedicated week, we're actually this month all doing a virtual simulation that's a telemedicine where they're actually conducting with a standardized patient a telemedicine encounter and then getting feedback with a faculty preceptor on that encounter, which is being recorded. So they can actually watch themselves doing that visit and then get feedback from their preceptor. So all of this in hopes that, like I said, they can really hit the ground running with you when they start. They've also been observed and assessed donning and doffing the PPE in the correct way. They actually get signed off on this prior to starting. We're doing kind of what we call a tap 2 or a reboot right now, since they have been out of the direct patient care. So in combination with Dr. Wares in the EM, we are doing simulated clinical cases. So this has been a great lesson in virtual OSCEs where we are debriefing via Zoom, as well as at a social distance place with at the Sim Center here. This has been so popular when we sent out the signups both for this and the virtual visit telemedicine encounter. Within an hour, all of the slots were full. And this is something they're not even getting credit for. So that tells you just how eager our students are. They also signed up for every single slot we have to practice pelvic and breast exams, placing IVs, and suturing. We are doing this at the Sim Center as well on mannequins, and they're getting one-on-one feedback from the faculty on their exams. So in addition, they're also completing online cases that are been very well done that we normally assign throughout the year, but in combination and in discussion with the course directors at UNC, knowing how eager our students were to get started, these were thought to be a great way to get their feet back wet, and because it's going to be a condensed curriculum, do assignments that they would be doing anyway. So even though these are not required prior to the start, I will tell you, because I can actually monitor their coursework, most of them are completing all of them right now. So they are definitely eager to get going, and I think we'll be well prepared.
Thanks, Dr. Birch. So before we transition into our keynote speakers to talk about how learners can be integrated into telehealth, one of the things that we wanted to outline due to some of the questions that came forward were, what are your platform options? And so part of the survey was asking you which of these platforms that you were actually using in your clinical spaces. Our compliance office is very happy to see that no one was using the free Zoom. Actually, no one was using any of our Zoom accounts. But you will see that a lot of our clinical practices, particularly here at Atrium Health, are using the doxy.me. But several of you are also using Doximity as well as Amwell. One of the questions was, what are some free options if your practice isn't providing? And I did want to share that Doximity, which is an app, you do have to sign up for an account, but it is free. They will allow multi-users to have access to your account, and when you either do phone calls or it will send texts to the patient if they have a phone that allows texting, to where they can link in through a text to a virtual visit. And so you can actually have, I think, up to 10 users within your practice on your one account that will actually pop up your clinic phone number so that your nurse or the student can actually start the encounter prior to you joining. And then for those that are part of Atrium Health, you have access to Teams and Skype through our Outlook and Office accounts. And then if you have an iPad or an iPhone, of course, some individuals are using FaceTime. The main thing I want to emphasize is that you cannot use anything that would be live streaming, such as Facebook Live. And at this time, I am excited and honored to introduce to you Willa Chen, Susanna Bracewell, Dr. Iris Chang, and Dr. Jay Patel, who are going to teach us their experiences and best practices in integrating learners into telehealth.
Thanks. Thanks, Dr. Tarantino. This is Iris Chang. I'm going to just say a couple of quick words, but really the students are our main teachers tonight. I wanted to, again, reiterate my thanks to all of you community preceptors who make it possible for us to teach so many learners in the ambulatory space. And I wanted to also say that we understand that this is a time of great change and evolution in the way we see patients, in the way we learn ourselves, and also with the way we teach our students. So we have this amazing group of students who are evolving right alongside us and who have provided support and actually lessons, as we've gone along. And so to provide a little context, Doctors Birch and Tarantino were mentioning the COVID-19 medical management course that was masterfully assembled at UNC in record time of 10 to 14 days. I don't know, Dr. Steiner can tell me more, but it was very quickly assembled with the expertise of their virologists and their clinicians teaching ECMO and the people doing system science and social medicine and ethics. And it was an incredible course that was put together very quickly with just a number of really nationally renowned, internationally renowned experts. But as a thread of part of COVID-19 medical management, the 4-week course that all the students were rolled into when they were taken out of their clinical duties, there was a telehealth thread that included all kinds of things from readings to simulated patients, some simulated video presentations, to some learnings around practice on using virtual health conversations and case-based learning. So there was an exercise where we had students working in groups of 3. One student memorized a script of a patient and was the standardized patient. The second student was the provider, and the third student was the observer evaluator. And each student in the group of 3 had a chance to play one of those roles during the course of that exercise. There were a number of other things like expertise in using telehealth and neurology and psychiatry. There were moments for reflective writing around telehealth and how this may change. It may widen disparities. There are some good things about things, and there are certainly some things to give pause about as we move forward quickly with how we do things. So I just wanted to say our students have been learning a lot about telehealth. They had several focused modules, learning modules, as well as a lot of reading over that time. So, and then also, as Dr. Birch and Tarantino mentioned, 8 of the students in Charlotte selected they volunteered to do a telehealth and interprofessional education elective, and 2 of our students gratefully are with us today. So Willa is a 4th-year student or individualization phase student, and Susanna is a 3rd-year student, a rising application phase student. And they are going to present some of the work that they did during the course of this 4-week elective, which just ended a couple weeks ago, on telehealth and IPE, on interprofessional education. So I'm going to let them speak, and then we can reflect together, and we'd love to answer questions afterwards. Okay, thanks.
Great, thank you, Dr. Chang and everyone for inviting us. So again, I'm Willa, and I think I know several of you from doing my 3rd year here, but today we'll be presenting on best practices and incorporating us medical students into your telehealth visits. And again, this PowerPoint was compiled by all of us who are doing the course, but it'll just be me and Susanna representing us today. So as a general overview, essentially for incorporating medical students into telehealth visits, we advise just modeling your in-person visits. So for simplicity's sake, we'll divide this PowerPoint into like a pre-visit, visit, and post-visit sections. And in terms of platforms, we'll mostly be talking about Doxy.me and the *67 anonymous phone call function, since that's what most of us were using. But our recommendations can really apply to any of these platforms. So regarding the pre-visit, there's several things that can be done to facilitate not only the patient experience, but also the med student experience. I would say that the biggest things to point out that are different from when you are in person in a clinic is the manner in which patient permission is obtained for the medical student to see them, as well as making sure you assess their internet and video capabilities. And these things can be done by the nurse before the visit, or it can be done at the beginning of the visit, especially if you're having like you or the medical student call them. And these are just some screening questions that our class came up with that worked pretty well for screening internet and video capabilities. And in terms of helping the medical student out, preceptors can kind of do what they've been doing just by providing a warm introduction to patients that they're familiar with. I would say you could either call the student at the beginning of the clinic day and kind of go over patients you would like them to see, and then just give a brief background or pertinent things for patients that you already know. Or you could just call the student right before each visit. And then obviously it's always helpful if the medical student knows to pre-chart before they see the patient. Regarding the actual visit itself, there's a couple options you can do. We recommend two main options that work pretty well for us during the class. The first one is essentially the equivalent of sending in a medical student to talk to the patient and assess them, and then leaving the room and presenting to the preceptor. And then after that, both of them go and see the patient at the same time. So that's kind of outlined in option 1 and then 1A. 1B is similar, except instead of presenting to the preceptor separately, you can try the triangle method to save time. And that's when the medical student can present to both the preceptor and patient at the same time. And then regarding option 2, that's essentially the equivalent of the preceptor and student going in at the same time and having the preceptor watch while the student leads the interview. And just some things I'd like to point out about option 1 is making sure your student knows to introduce their affiliation with the clinic and doctor, because then the patient is more likely to actually agree to be assessed, rather than introducing themselves as, hey, I'm a medical student, can I talk to you? And then also making sure they confirm the patient name and date of birth. These are just a couple of things we're not really trained to do in medical school, since usually the patient's already there in the clinic room. Then regarding option 3, this video link is just a link that's showing you how to start a three-way Doxy.me. But whatever platform you use is fine. I would just advise with Doxy.me that you add the patient first. The way you start the three-way is you have to have both people in the waiting room, and then you start a call with one and then you add the other. I was just once added to a call and the patient was added after me. And the first thing they saw was my face. So they were kind of confused and flustered, and they were like, "Doctor, I think you left another patient in the room." So I would just advise adding the patient first. And then the box below just shows some tips that can help. Just some things I'd like to point out are that the preceptor can always see other patients, either in office or call other patients while the student sees or calls one patient, just for time and efficiency's sake, and that you can use interpreters on the calls. You could either do just a three-way call without the student, or you could do a four-way call. And I believe most platforms, including Doxy.me, should allow for that. And then I'll hand this off to Susanna.
Hey, I'm Susanna, again, a brand new third year for 2 whole weeks. So I'm just going to be going over the post-visit part. What I found was easiest with my preceptors was to just stay on the call, the two of us, and we kind of went over what happened during the visit. But you could also just hang up the phone call and call the student again and do like you would normally do in an office and debrief on the case, ask and answer any questions, kind of give instructions on what you want the student to do for documentation purposes, and then provide two-way feedback. And then again, having the student write their own note is always very helpful. either the student writing the note themselves or you starting the note and the student taking it over, which I know a lot of people like to do, like Dr. Chang, so that it shows that it's authored by her. And then it might be helpful to mention to the student to tell like video capabilities in the note, and if it was like in video or in person, and then also helpful for the preceptor to provide feedback to the students on the notes. And then I kind of wanted to jump into some things that we did in our class portion of the elective. So we had a focus on screening for social determinants of health. This was so that we could provide, more socially informed care, which is obviously important and now more so than ever, I feel like. And so we use this questionnaire, which is integrated into Canopy itself, and it's the standardized questions from the state of North Carolina regarding social determinants of health. It focuses on 4 categories such as food, housing, transportation, and interpersonal violence. And this can be done by the nurse or the medical student in the pre-visit. And obviously you can follow up with referrals with the Community Resource Hub or to social workers, but that was something that we tried to focus on in our class, and it's hopefully being rolled out by the end of the year to a lot of clinics. Dr. Chang knows more, but something that we just tried to do in our class, which we found really fun and helpful. And so on the next slide, we're going to be talking about some of the stuff that we saw in our visits in our course. So we saw 105 patients between the 8 of us, and 61 were video and 33 were phone only, and some of the rest of them were in person. And we actually noticed that 31.4% of our patients didn't have video capability. It really just depended on what clinic people were in and the area that they were serving. And we were able to screen 45 patients for social determinants of health. And some of the barriers that we encountered during our virtual visits were probably very similar to what you guys have been encountering in your daily virtual visits, which is just the lack of access to technology, the lack of standardization. I know a lot of patients are also worried about the confidentiality of video visits. And obviously the stuff of in-person that you get in person that you don't get over the phone or video, which is the exam and lab work and imaging. And I know there were some worries about reimbursement, but I know that's all been resolved by powers above me. So yes, and now student notes count too, which is great. And then we also had some tips for in-person visits, because some of us did do in-person visits. For example, I did some did some phone with Dr. Chang and some in person with her, so we have some practice with that. But just wanted to reiterate that we don't have any limitations with regards to patient care, and that we are, at least from my knowledge, all ready to be screened like any other office employees. No special treatment. But we were also saying that if you were uncomfortable with having a student in the exam room, it would be great to have us in, but we don't necessarily need to be in. We could kind of format it in the way that we've been doing the video visits, where, we kind of debrief after and the student can go in first, like a normal exam. And then the provider could go in, and then we could just debrief afterwards if that makes you uncomfortable or your office space is not big enough for 6 feet of distance. And yeah, these were our preceptors that we had during our elective. So we were very grateful to them. And so we just wanted to say thanks and then see if we had any questions, which I see the chat.
I wasn't sure if I could view the chat while screen sharing, so I haven't been looking at it. I'm sorry.
That's great. I think there are several good points, and I think thank you, both of you. Susanna and Willow were just great students to work with, and we met every Tuesday afternoon and did a lot of this sort of group activity and brainstorming. They had a small capstone project, some of which is presented today. So thanks for sharing that with everyone. And let's see, I'm just kind of looking over the questions, and I think there are some, Delise Bright mentions the question, what if patients cannot access doxy.me and some patients can only do phone visits? And in fact, when we did ask the questions, do you have access to internet? Is there someone in the house who has two-way video? It turned out that about a third did not have those. Did not have video capabilities. So that was very significant for the community and academic clinics. Generally, the specific population we were working with during the course. So that is something. And then Jewel Carr asked the question, what if we want to be mindful of the amount of time we use on the phone. Let me see if I can find it. Number of calls we make to patients because they may not have unlimited plans. And again, I think there's probably room in our pre-visit to really ask what capabilities you have for video calls, but also what type of phone plan, what type of phone you have. And apparently there are also some government issued phones that have very limited, some limited capabilities there as well. So those might be questions that we might add to our pre-visit list, either for our nurse or even have our students ask with that first phone call. We want to open it up. Let me see if there's any other questions regarding, our platforms here at Atrium have changed quite a bit. And Dr. Steiner was asking about doxy.me. If you, I don't know if there are any people from Novant on the call, but Novant has Epic, which has embedded Zoom for healthcare in their record, and that's very convenient and seamless, and you can really launch it completely from within the record, but we don't have that. We don't have that convenience. And then Dr. Patel mentions that, he'll see folks and actually split screen, I guess is what he's, I don't know, Jay, do you want to say sort of what your screen looks like when you're doing a video visit in addition to charting and keeping Cerner?
Yeah, sure. It's a little hard sometimes if you have like a laptop. So what I'll do is either I'll open up the doxy.me on a web browser on my phone and then use that while documenting on a laptop. Mm-hmm. Some individuals have like two screens, two like separate, I guess, LCD monitors that they use when they're documenting. That makes it sort of easier. But if you have a student, they actually can document for you. So it kind of eliminates your need to have to document simultaneously while the patient's providing their information. And I found that having students, like I had the opportunity to work with Susanna and Willa, and they actually sped up my efficiency, and I was able to add more patients on my schedule as a result. Mm-hmm. So I think incorporating students in virtual visits is probably faster and easier than incorporating them in the in-office visit, just because of the fact that while they're performing their history, you can knock out some patients in your schedule.
Great.
And then I think there were some questions about billing. With phone management or virtual check-in visits, technically you can't incorporate student time into billing, but if it's a video visit, you can still bill the same way you would like a 99213 or a 99214. Medical decision-making complexity is actually what you can use to help determine your level of service that you provide for that encounter.
Yeah. And I also see a question from Erin Trentham asking, if we have enough office visit is okay for the students just to do the office appointments rather than the phone or virtual visits. And I would say that there's great flexibility here. I know we're all transitioning and every clinic day seems to be completely different from the last, for me at least. And I think that while we'd like the students to get some exposure to phone or virtual visits as part of their experience in the clinic, the amount of that or the proportion of those visits compared with in-person visits is going to be highly variable. So I would say, particularly as you're learning yourself, there may be opportunities, there may be certain days where it's possible and other days where it's not. So I would say leverage whatever you've got in your office, whether they're in-person or virtual visits. And a lot of our visits are on phone, for instance. We didn't have a lot of video visits the first several weeks because our patients didn't have the capabilities, but I think things could change. And again, we're increasing our visits, our person-to-person visits as well. So that will give more opportunities for the students to see the patients directly as well.
Yeah, and I would say, Erin, in-person visits are great because our students have been doing a lot of virtual. They will get plenty of virtual and phone visits this year. I think we just wanted to make sure that people knew how to do these with a student. But I know our students are eager to see people in person.
So if I can interject just quickly, and this may help answer some of the questions about the inpatient, because I know Susanna and Willa touched on this briefly, but there's multiple different ways that you can incorporate the students into your clinic space. So again, if social distancing is an issue due to the size of your exam rooms, you do have the option of allowing the student to interview and examine the patient alone. The student can then present to you outside of the room if that's preferred, and that can even be done virtually. One of the faculty, Sarah Smithson, last evening on a meeting shared that she actually just opens up a like a WebEx or a Teams meeting with one of her students, and they use that all day to touch base so that they can be socially distanced within the clinical space or in 2 different areas. Also that realize that as a preceptor, you need to confirm the history and exam that the student presents to you if done outside of the patient's physical presence. That is a key to billing, that the preceptor has to repeat the history and pertinent exam findings that the students document. The other thing that UNC has really made benefit to us in the clinical space is that all the students have iPads. And so realize that students can actually do documentation and visits with patients via their iPad. Documentation can be done at home or in a separate distance space. So for example, if one of your partners isn't seeing patients that afternoon and an exam room is open, the student can actually be working from that space, communicating with you distantly, but still in the clinical space, either seeing patients that are in the clinic or doing video or phone visits with your patients. Also, just realize that if you want the student to present in a distant manner, that you can also do that virtually. Again, with Atrium, you have the option of Teams, as well as a lot of us have FaceTime, or just regular phone visits between you and your students. And again, just reiterating that the students don't have to be all patient-facing and all virtual. It can be a hybrid. If there's a particular day that you're going to be doing virtual visits, the student can actually be in their own space doing virtual visits with you. So just because you are not in the office doesn't mean that you can't precept. There is a lot of flexibility. We do ask, though, that if you're only going to be seeing patients remotely, that you let us know so that we can ensure that the student gets exposure to those patients in other clinics to learn true physical exam findings. So for example, if you're pediatrics and you're only doing virtual visits, then we would want to make sure to pair the student with a family practice physician that also sees peds, where they can learn the pediatric exams. And so I know that there's more questions popping in, and so I will allow Celeste, Iris, and Michelle to pipe in on any questions that have popped in that we haven't answered. And if you have a question that you haven't put in the chat and you want to ask it, feel free to unmute yourself and ask while we go through the questions in the chat.
I wanted to add, this is Iris, that we will be sending some resources for preceptors with regards to virtual care, telehealth. And Dr. Waxman just asked the question of just how to get 3 people on the line for a video visit and whether they could talk about the patient and debrief while the patient is left in a waiting room. And there are ways to do that. But we have, Dr. Birch has made some nice screenshots of doxy.me, and there's also ways to do this in Doximity that we found out. And then I found out that the students actually, again, like Jay Patel just mentioned, that, you know, Willa has taught them a lot. I have learned a lot through Susanna and Jeremy, and I've worked with Reem. A number of the students have really, they're fearless in exploring different ways, and we have tried different ways on different platforms. And so if your patient has the capacity to make video visits and is not on a timed, some sort of a timed plan for their phone, having the patient stay in a waiting room or having you 2 separate is a possibility. Let's see. And is a 3-way visit possible with Teams? And we've been told that Teams can accommodate several people. I've not done a 3-way, but I've heard that they've been told that it's possible. Has anybody done a 3-way visit?
It's just like doing a meeting, so that you would have to send a link to the patient, but there's no limit on the amount of people that you can put on a Teams encounter. There was a question, go ahead.
No, go ahead.
I was just going to say there was a question because a couple of people have joined late about what personal protective equipment the students will be provided. So they have protective eyewear, as well as if your clinic is okay with the student bringing their own surgical mask. Some are not. Some want it to be something that they have supplied. The students can bring surgical masks that we and UNC are providing if your practice prefers that they do that. We just need to know so that we can make sure that the student has a supply to bring to your clinic, but they would have surgical mask and eye protection. And then there was a question about students attending procedures. That is fabulous and encouraged. It depends on where you're going to be doing the procedures and what type of procedure it is. So if you are doing a procedure, if you wouldn't mind to just reach out so we can make sure that we are ensuring that the student has access to the proper PPE that is required depending on what type of procedure is being discussed. Great question about whether or not we have an update from Novant as to whether or not they'll be allowed to accept students. Celeste, would you like to share the breaking news?
I had a great phone call today with Winston-Salem headquarters, and we are actively scheduling the students for their onboarding, and they will be able to enter the practices that we asked for as of June 29th. So we're thrilled that that's opening back up.
Great.
Thank you. And again, just to reiterate, we are working on creating kind of like cheat sheets to help guide you on how to incorporate learners into telephone and virtual encounters. And so that's one reason why we were asking what type of platforms that you're using so that we can try to make cheat sheets for the various different platforms, and that will be distributed here in the next couple of weeks. Sorry, I'm trying to read through questions. If other people have comments to answer, feel free.
I saw, go ahead.
I appreciate Pam Cobb's comments, and we know that some people's rooms are small, and the physical exam can be difficult. I think some of the workarounds, and that's one of the reasons why, honestly, we are having the students all practice the breast and pelvic exam now on mannequins and getting direct feedback on that, because we know that it may be a while, before you're able to give that. Some of the creative things, as around the country, what's been great, a lot of medical educators in the same position, and they've talked about creative ways of doing this and observing them. One is, like Heather talked about, having a virtual setup so that you can actually observe the student do it and practice. Obviously, mainly concentrating on those things where you can have the student, as much as possible, gather the history, do the non-sensitive parts of the exam on their own, then come out and present to you, and then give them feedback. Obviously, we understand that it may be difficult, especially if you have an interpreter in the room as well. I have done some virtual visits with interpreters and been able to add the student. And actually, because the interpreter it can, with some of the platforms and the three-way calling, the only downside I found is sometimes it can be an overload on the video function. And so in that case, what I've encouraged is whoever is not talking, so if at that point it's the student, I turn my video off and vice versa. And I found that's a way that you can all learn, but because they don't necessarily need to see either my face or the student's face, depending on who's conducting the interview, then I found that to work quite well when I've been with our residents in particular, that we're able to all be part of the visit without decreasing the bandwidth.
Actually, several of our students had experience in the 4-week elective working with interpreters, and none of the students had particular difficulty. The key, though, is that the interpreter, usually the preceptor and or the student, reaches out to the interpreter, and then the interpreter reaches out to the patient, but they were able to do that. There was a question about patients that may be on ventilators. And according to Atrium Health policy, if a patient is coming in on a ventilator, it would probably be a patient that the student should probably electively not see, just because of the aerosolization from the tracheostomy if it requires any type of suctioning and such at that time. But we're happy to discuss that and explore if that is something that you feel that the students need to experience in your clinical setting.
I see a couple of questions that have come up around N95 masks for the students, and I don't know if Dr. Tarantino or Birch can talk about access for that, if the preceptor anticipates needing N95s for procedure in the clinic.
So again, if you feel that the student needs an N95 for a procedure in your clinic, please reach out. We have access to N95s easily not easily. We have access to N95s in the inpatient setting. We have created protocols where the students get them at a particular place, they return them to that place so that we can go through the decontamination process to try to preserve our supplies. We have potential access of getting some N95s for outpatient. We would just have to talk through why that is necessary and whether or not the student has access to that patient in another setting. N95s, due to a delayed shipment from Greenland, has become an issue. So that we would need to discuss.
It may also be helpful to know that the UNC students in Chapel Hill do not have access to N95s currently. And so because there's relatively few procedures where N95s are required, where students have to be present, it may be reassuring to you in terms of comparability that your students, if they did not have access, that's comparable to what's happening in Chapel Hill currently.
I see a question with Novant Pediatrics, just that they're requiring N95s for any in-person patient who might cry. And I don't know, I'm curious whether the Atrium Pediatrics or the family medicine folks with the kids, is there any practice necessitating an N95 for a child who might cry?
Not in our current practice right now.
This is specific, sorry, this is Daniel Donner. I'm the one who asked the question. This is specifically a Novant policy that just came down the pipeline last week. They're requiring that we wear N95s for any child who might cry, and any like dental varnish procedure, any up close and personal procedures, because there's some very scant evidence that perhaps maybe it could cause aerosolization of the virus. So now we have to use those. And I was wondering specifically about fit testing and if we would need to provide those N95 masks, which you just answered.
So, and as to answer the question about fit testing, so all of our students are fit tested. You know, a lot of us are using very different supplies and suppliers than what the students were fit tested on. So part of our donning and doffing is we're helping to instruct the student on how to do their own equipment checks. Because I know I wear a small N95, and so we are being asked to use a different model, and so fit testing will not be an issue, but let's discuss offline how we can try to ensure that the students have access to a good experience there, and want to try to find a solution to the N95s. The other thing I'll point out is that there is a national webinar from the Group on Regional Medical Campuses this Thursday evening on integrating learners into your clinical sites, talking more about policies as well as the changes in the clinical environments. If you would like to participate, feel free to email me, or if you want to just put your email into the chat, I will be happy to send you that link. And it's this Thursday, I believe at 5 p.m., but I will double check that very quickly. Actually, it's 2 to 3 o'clock. Usually those are recorded, so if you want me to forward that on to you, I'm happy to share. And then Dr. Steiner had also shared that if you're interested in participating in the diversity and inclusion town hall conference. That is tomorrow evening, and I can forward that link to this listserv. And those of you who are interested, you can join that phone call. Other questions and comments?
Thank you all. We will certainly be gathering some materials for all of our preceptors, and we'll be sharing those in the next week or two before the students return. But please reach out to Dr. Spatel and Dr. Brantley for pediatrics, Dr. Birch, Dr. Tarantino, or myself if you have any other questions. We are available.
Yes, and if there's any other platforms we haven't touched on, please do send that to Celeste too, so we can collate some of those, you know, easy ways to do these three-way visits. And like I said, if it's a platform our students haven't learned, it's one that they are such quick studies. And huge thanks to Willa and Susanna and all the students that couldn't be with us tonight. They've just been trailblazers on this, and it's been really great.
I want to add my thanks, Susanna and Will. You were tremendous, and I was holding on to every word. I'm trying to learn. You have a lot to teach all of us. And to the team that's running all this, you've worked hard these past few months in really transitioning how you do your work, and I really appreciate it. Thank you.
Yeah, it's so inspiring that sometimes crisis does cause or create creativity, and just it's really inspiring to have the students help lead this. So thank you so much to both of you and the other ones who were involved.
All right, we will share the PowerPoint as well as the video, as well as the links to the two different webinars, the one for UNC and the one through the group on regional campuses. We'll just do a mass emailing with all details in one document to simplify things. So thank you all for your time this evening. We greatly appreciate all that you do for our students and for our learning environments, and we look forward to partnering as we move forward. Thank you all.